Design a care gap evaluation process. Healthcare coordinators tailor care plans based on industry standard guidelines and the specific needs, conditions, and preferences of each patient. However, if a patient's care plan differs from the recommended guidelines, it means there's a care gap. Healthcare agencies must reduce these gaps to improve overall healthcare quality. Here's how Bloomington Caregivers, a home health care agency, is minimizing care gaps. Bloomington currently uses Health Cloud to provide coordinators a 360-degree view of patient information. Bloomington now wants to set up the Care Gap feature in integrated care management so that care coordinators can evaluate clinical measures and identify gaps. For the evaluation, Bloomington uses standard clinical performance measures like healthcare effectiveness data and information set, also known as HEDIS. These measures provide a set of standardized guidelines that define what constitutes high-quality healthcare. The evaluation process happens in 3 stages. First, define the clinical measure and its computable criteria in measure objects. Next, configure the criteria in a business rules engine that applies advanced logic and automates complex decision-making. Finally, set up a flow to collect and send data to the rules engine for evaluation. Now that you're familiar with the evaluation process, it's time to set up a clinical measure for assessing care gaps and enhancing patient care. To learn more, check out these resources. Or join us on the trail at trailblazer.salesforce.com.